The following is a worked example of a hand x-ray demonstration by Catherine Severson at Tech513. The following paragraph contains the pre-training prerequisites necessary before continuing on with this demonstration. Read the paragraph, and if you feel as if the prerequisites have been satisfied, continue on. The following demonstration consists of 3 parts. The 3 parts are listed here. Part 1, patient history and assessment, and a list of the topics we'll be covering. Technologist introduction is step 1. As soon as you retrieve your patient, make sure that you introduce yourself and begin to establish a rapport with your patient. Step 2 is correctly identifying your patient. This can be done in several ways. Often a name band is checked for comparison of names. You can also check the birth date or the medical record number to be sure. The next step is identifying which part and what side of the body has been injured. Here we'll pause for a self-reflected inquiry. Read the following 2 questions and think about possible solutions. When you've thought about your solutions, continue on to the next slide to read some possible answers. Read these possible solutions to the self-reflected question in the previous slide. And note that the word possible is used here because within this field itself, there's always multiple solutions to any question that arises. Continue on when you feel as if you've read through and understood this slide. Next, in the patient history and assessment, you want to ask the mechanism of injury. It's important to understand what happened to the patient radiologically speaking in case that any factors need to be adjusted technically or positionally to reach your end goal. The following is a list of characteristics that you'll be looking for when visually assessing your patient and their injury. All of these are potential problems that could arise that may cause you to have to change your plan. Part 2, the exam. The following is a list of topics that will be covered in Part 2. Step 1 is room setup and preparation. You always want to be prepared for your patient and make sure that you have located everything that you'll need to perform your exam from start to finish. Next, you'll select the film size that's appropriate for the part being imaged and select a correct technical factor from the console. Make sure next that you shield your patient, always practicing the concept of ALARA as low as reasonably achievable when it comes to radiation dose. Next, and most importantly, position properly, maintaining correct SID selection and appropriate collimation. Continually assess your patient throughout this entire exam process, making sure that they're able to do what you're asking them to do. Another self-reflective pause for inquiry. Read the following question and continue on when you've come up with a solution. Here's a possible solution to the previous self-reflected inquiry. It's important to maintain flexibility in everything we do as technologists, understanding that although a patient might not be able to do a textbook protocol as you've learned in class, that there are always ways around the status quo. For example, in this image, it's showing a cross table of a wrist rather than having the patient manipulate their arm. Lastly, in the exam process is the actual exposure. Ensure that you're always watching your patient so as they don't move during the exam and you expose unnecessarily. Part 3, post-processing and image quality assessment and the topics that will be covered within. PACS system and post-processing. Now that you've achieved an image on your cassettes, ensuring the following occurring in this order will be the first step to a completed exam. After your exam has been run, assessing for image quality and quality points is the next step. Along with image quality assessment comes the concepts that we've learned in class, the technical factors that include contrast, density, detail, and distortion. The last pause for inquiry. Read the following questions, and when you feel as if you've come up with your solutions, read the next slide to see how you've done. Possible solutions to the following question. Now that this demonstration is coming to an end, here are some scenarios that I'm presenting to you to discuss with your partner amongst yourselves. You've seen a worked example, and we've discussed several possible potential problems and the solutions to those problems. There's no real right answer, and there's always multiple ways to do things. So read the following questions and be confident in your professionalism and in the education you've received.